The coronavirus pandemic closed German schools in March. Then came the summer break. Now some have reopened. But the process has not been without controversy and setbacks. A few schools have already closed again after COVID-19 cases were found. Critics say authorities haven't come up with consistent strategies to protect school children. What's more important, educating kids or keeping everyone healthy? Or can we do both? Welcome to your COVID-19 special here on DW News. I'm Monica Jones in Berlin. Good to have you with us. Wash your hands, wear a mask, keep your distance. Now, those are the rules. But when even adults struggle, how do you convince school kids? With a COVID-19 rap, of course. Watch out, here's Dr. Quentin J. Lee.
You can't touch this. You can't touch this. You can't touch this. You can't touch this. My coronavirus hits me so hard. All the teachers say, oh my Lord, COVID is stressing me. All the updates from the CDC, Lysol can't be found. I've looked all around this town. I've had no luck. And these are the things you can't touch. I told you, students, you can't touch this. You better pull that mask up. You can't touch this. It's the CDC, not me. You can't touch this. Hey, go wash your hands. Touch this. Fresh new rules and plans. Let's all be safe. Go wash your hands. So move back up 6 feet. You better not cough and you better not sneeze. Sanitation. Hold on, let me check your temp. Not under your arm like that. Like that. You're all clear. Go to the back. Everybody says that this is too much, and these are the things you can't touch. Yo, I told you. You can't touch this. Why are y'all standing so close? Back up. Oh. Can't touch this. Every time you see me, Dr. Lee is sanitized. I'm gonna keep my hand clean because the cases are on the rise. Now, why would I ever stop doing this while others getting ill? I don't want to be sick.
Yep, this is still COVID-19 special here on DW News, and that was Dr. Quentin J. Lee, a rapping principal from Alabama, USA. Cool. But it's not that simple, is it? At least not everywhere in the world, because to wash your hands with soap and water, you need access to soap and water. And according to the United Nations, 43% of schools around the world lack exactly that. Now, that's bad at the best of times, but during a pandemic, it poses a major health risk to school kids and teachers alike.
As schools around the world struggle to reopen after the lockdown because of the coronavirus pandemic, the first lesson in classrooms is wash your hands. But for many children in least developed countries, this is not an option because they lack basic hygiene facilities. A UNICEF WHO report shows that 818 million children lack basic hand washing facilities at their schools, which puts them at increased risk of COVID-19 and other transmittable diseases. More than 1/3 of these children, 295 million, are from sub-Saharan Africa. In the least developed countries, 7 out of 10 schools lack basic hand washing facilities, and half the schools are without basic sanitation and water services. With children's learning a priority, the report says governments have to make sure that schools are safe to reopen. That means access to hand hygiene, clean drinking water, and safe sanitation.
Now, an article by the Harvard Graduate School of Education in Massachusetts has looked into the challenges primary schools are facing in this pandemic. Müge Cevik from the School of Medicine at the University of St Andrews was part of the group working on this article, and she joins us now from Scotland. Good to have you with us. Now, as you know, education is a central theme in the UN Sustainable Development Goals, as education can prevent or even eradicate poverty. So it's very important. But given the rising case numbers in many parts of the world, is now the time to put education before health?
Thanks for having me on the program, first of all. But no, we must give equal credence to both. We must not choose one or the other, but appreciate the vital importance of both the health of our society as well as the educational and social benefits provided by schooling. Neither can be ignored. Especially, I think one thing we need to appreciate is that we're not discussing the effect of 2 months disrupted learning. which may fade away by the time students complete their education, but there are also long-term impact of school closures, particularly for the disadvantaged children. I mean, for example, disengagement from education might have substantial impact among students from less privileged backgrounds. In France, approximately 1 in 10 French students could not be reached 2 weeks after school closures. Similarly, in Los Angeles, almost 1 in 6 high school students still not had any contact with teaching staff. So I think, given that SARS-CoV will be with us for foreseeable future, long-term impact of school closures must be weighed up in any policy consideration.
Right. So it's really important to bring the kids back to school. Education is important. Also, the social circumstances are very, very much important. But your article found that there are differences when it comes to the age of students in this pandemic. Primary schools seem to be fairly immune. Higher schools are more at risk. Is that assumption true? And if so, do we know why that is?
I think we need to be cautious with the terminology because children are not immune. They can be infected and infect others, but the disease is often less severe. And given the same exposure to an infected adult in a household setting, for example, children under the age of 10 seem to become infected less frequently compared to adults and older children. So when we talk about children, I think it's important to differentiate young children from older ones. I think the differences we're observing, it's not entirely clear, but possible explanations would be differences between younger children, older children in terms of height and their social contacts, social networks. For example, when we look at many older children, they have similar social contacts as adults, very complex social networks. And other possibilities also include immune response and also protective immunity provided by previous exposure to other viral infections. For example, other common cold viruses that's much more common in younger children might be some kind of providing some preventing factor.
So, yeah, so there are many different factors at play there. And of course, all the schools, every school has a different approach how to go about it and bring children back in a safe manner. Some schools insist on kids wearing masks in all the classrooms. Others say that's not necessary, but they want to keep kids in smaller and separated groups. From your observation, is there the ideal school model? What is key for opening schools without risking more infections?
I think at the moment we can't say anything is completely safe. It's all about relative risk. As it stands, the evidence would suggest the risk of significant transmission events are lower in primary schools than, for example, higher grades. And I think when it comes to interventions, what interventions to utilize, we need to consider many factors, including local transmission and the resources available. For instance, in New Zealand, Finland, they reported that they managed to prevent majority of outbreaks just by isolating symptomatic cases. Taiwan successfully kept schools open throughout the pandemic by keeping the infection rates at negligible level. Right. In our review, what we found is especially classroom crowding and other factors related to social distancing in classrooms may play a role. For example, Denmark, Austria, Finland have various mitigation strategies, but they also have smaller classrooms compared to Israel and Chile. So distancing becomes much more of an important factor, so preventing crowding.
There is no one-size-fits-all. That is definitely something we've learned from this Müge Cevik from the School of Medicine at the University of St. Andrews. Thank you so much for your time, and it's worthwhile looking at the article.
Thank you.
Now, while most of us try our best to deal with the current health crisis, some are desperately looking for a culprit, someone to blame for this pandemic. No, it's not our science correspondent Derek Williams, but he can answer some of the questions you have, like this one.
Is Bill Gates behind this mess?
If you believe this already, there's probably nothing I can say or do that will make you change your mind. But But I wanted to talk briefly about the big scientific reason why the answer to this question is no. First, a fact. Bill and Melinda Gates, with their foundation, have undisputedly contributed billions to advancing healthcare programs around the world. They've arguably done more to improve human health than anyone else in history. To be behind this mess, as you put it, the only thing I can assume is that you mean they would in some way be behind having SARS-CoV-2 created by evil scientists in a lab. But SARS-CoV-2 wasn't bioengineered. The expert community widely agrees on that because for a number of science-based reasons, the evidence that it wasn't bioengineered is compelling. So regardless of what you might think Bill Gates is capable of, and though I don't understand it, I know there are a lot of people who think for some reason he's a supervillain. He can't be behind this mess because he couldn't have done what he's accused of. And if he had done it, we'd be able to tell.